doing this is to try and inspire young girls and young women at the very earliest stages of their career to take the stories of women who have made it and to show them that it's possible and that there are very many routes to getting there. So what I'm interested in today is looking at the routes, if you like, of how you got from being at home, at school, to coming right the way through to being the woman you are today.
I was born in Gdańsk in Poland. I had two parents who were doctors. In fact, both were professors of medicine, and I've always thought that something academic will be my career. But it wasn't to be medicine at all. I had a teacher at school who was absolutely wonderful. He was a geography teacher. He took us for various skiing trips and other summer camps. It was absolutely wonderful. I was entirely in love with him all my secondary school, and I decided to be a geographer. My mother was absolutely horrified by this. And as the professor of geography was a very clever man and she knew him, she got from the back and got him to talk me out of it. And she was a very clever woman, and she did talk me out of it and talk me into medicine. And that was the best thing she probably has ever done. So I studied medicine in Gdańsk, in my home city. That's how it was then. And there I qualified, and about a year after, I got married during medical school. In our days, this was the thing to do. The story went that if you didn't get married in medical school, you'll never get married because you'll start your house jobs and be terrible, and that's you. So I got married at 21, third year medical school. I went early. And when I qualified, my husband, who was 3 years older, was looking at opportunities to maybe go and see world a little. And he got a job in Malta, of all places. You all know Malta, a little sunny island. So he was there. There was communism, socialism, Iron Curtain, all this stuff. And he was there, and I was still in Poland, and politics was getting hotter and hotter. We all joined Solidarity. My entire hospital joined Solidarity. It was extremely interesting if you wanted to be a politician, but very difficult if you wanted to be a scientist. Science really didn't have any place there, medical science or any science. So my husband talked me into going to join him in Malta, which I did. I worked for a year in the only hospital on the island, doing full-time diabetic clinic. It was great fun. They have some very interesting diseases. MODY, maturity onset diabetes of young, very, very common. I learned a lot. But they also had huge UK influence, particularly Scottish influence. So there were lots of consultants from Scotland who came to examine in medical school. They had small medical school there. Certainly all postgraduate training could have been done in the UK for the memberships, for fellowships, etc. So we listened, looked, and thought that might be one option, whilst doing American exams and not knowing what would happen. And then martial law started in Poland, and there was only one way. We either went back and might have never gone abroad again for years, or just taken a plunge. And we've taken a plunge. And with 2 suitcases and falling apart, Fiat came to United Kingdom on a 3 months visa. And my husband had a job, but I didn't. So he's a clinical biochemist. He had a job as a registrar in Glasgow in clinical biochemistry. It was 12th of July, 1982. Rain was pouring in a wall of rain. And my husband said, I know this city, I'll take you for dinner. And we went to Great Western Road to a little thing that looked a little bit like soup kitchen. He tells me it wasn't, but I had difficulty recognizing this. And that was the beginning. And we lived in a student's accommodation in Maclay Hall, for old Glasgow student accommodations with bathroom in the corridor.
I mean, that must have been a big leap of faith because you came across without having a job.
Yeah.
And at a time when going home would be very difficult, as you say, or
Well, there was one way, yeah.
you'd have gone there, but you probably wouldn't have got out again in that time. So what was the next step then? Your husband was here working?
So my husband was working in the Royal Infirmary. It was hugely interesting, and I went to meet his professor. There was a big professor of biochemistry at the time in Glasgow. And I said, I would like a job. I wonder if you could advise. And he looked at me. I was younger and tanned, and he said, a job in the casino would be good, he said. I said, no, I would like to be a professor of medicine. That's my plan. He looked at me like I was completely off my head, as they say in Glasgow. But I persevered. So I looked at BMJ every week, and there was an advert that I was looking for. This was a house job. So I already did house jobs equivalent in Gdańsk and then a year in Malta, but there was a house job in the Royal Infirmary, the academic hospital, and I thought that's my way in. So I went for the interview, and very wonderful consultant, respiratory physician, Dr. Frank Moran, gave me a job. And of course, before I had to do, I forgot. Of course, at that stage, there was no European Union for the Eastern European countries. Poland, my medical school degree was sort of recognized, but not fully, and I had to sit the exam. And I did this exam because, of course, I couldn't get a house job before the exam because I needed temporary GMC registration, provisional GMC registration. So this exam was interesting. It was held in the Royal College of Physicians and Surgeons of Glasgow. There were lots of people there, but not like me. Mostly colleagues who graduated in India and Pakistan at this stage, who were coming to do house jobs and membership here. And I passed. Interesting. It was a little bit like membership, but just a little lower level, I think, but the same sort of style like membership. This exam still exists. So once I got that, I could become a resident. I became a resident. And in my first day in the job, I was sent to the gate, the biggest accident and emergencies department and the busiest. It was 1st of February in the country, and it was great fun. So I thought my English was very, very good at that stage, but to understand Glaswegian in the East End, it was fine in the morning, but as the day progressed, around midnight, things were a little different. But I survived and then got a job in Paisley. So, of course, I wanted to enter medical rotation in Glasgow in one of the teaching hospitals, but that was very difficult. I wasn't the usual. At that stage, there was one woman consultant in the Royal Infirmary, renal consultant, and in entire Glasgow, there was one woman professor in anything medical, and this was Professor of Dermatology, Rona Mackie. Wonderful lady. There were lots of very nice ladies, but there were very few of them. So role models were few and far between. So I went to both professors. There were two professors of medicine on both sides of the city, one in the Western Infirmary, one in the Royal Infirmary, and went to see them both. One looked at my hand and said, "You are married, dear." I said, "Yes." He said, "Why don't you go home and have some babies?" The year was 1983, not that far away. The second one, on the other side of the city, said it was a very busy year this year and we've had lots of local great graduates. Unfortunately, I can't even interview you. So I went to Paisley. You know Paisley? Lovely town near the airport. And it was a great place because it was extremely busy medical unit. There was one woman consultant there, geriatrician, wonderful, Dr. Joan McAlpine, who became my role model at that time. And what they did was, this was a 3-year rotation. And because I said at the interview that I want to be a career physician, they got me to start from a year of pediatrics. So I spent the entire year doing special baby care and pediatrics in Hockhead, very old hospital. Special baby care in the Vale of Leven, small hospital near the Loch Lomond, and all sorts of interesting things, but not really medicine. Second year was general medicine, and third year was geriatrics. And my ambition was to do all exams, so part 1 and part 2 of the membership, and to have a baby. I managed all this just. So my son was born halfway through this rotation, and some very, very interesting experiences in Paisley, because there's never been really a woman who came back after having a baby. That wasn't the thing to do. So when it came to, I worked till quite late, wearing double lead apron for putting the cardiac pacing in the middle of the night and stuff. So remember this double apron, I'm very small. It was very, very heavy, but the nurses were wonderful. Eventually I couldn't climb up the stairs to the on-call room, so I sat all night with the wonderful nurses who were hugely supportive. But when it came to going, stopping for 3 months, they gave me presents and they said, you say you're coming back, you're never going to come back. This lovely baby will be born, you're never going to come back. Presents. Of course, I did come back when my son was 2 months old, and it was difficult. So I was trying to breastfeed and do on call. At that time, we came to work on Friday. We worked all Friday, then Saturday and Sunday, all day and night on call. And on Monday, there was diabetic clinic that never finished by 5 o'clock. So that was, I think, more than 100 hours in one go, not in a week, in one go. My husband was absolutely wonderful during this time. He brought the baby for a while twice to the hospital, so I could still continue feeding. This was really heroic. He did bottle, he's biochemist, so the bottle, then when of course it didn't last long, this feeding in a job like that, I managed 3 months. But he did all the bottles because this was biochemistry. It helped a lot. It was great. And I had nannies. And nannies didn't last because I never came back on time. So by the time he was 4, I went through 10 nannies. But it was worth it. And then eventually my mother came to help and everything changed completely. Now when my son was 4, we went to United States of America for a fellowship, which I got through the British Heart Foundation. And this was a great thing to do because by that stage I was in the MRC blood pressure unit, I should say, which was wonderful dream research job, but the unit by that stage wasn't doing great, and on the retirement of director it was closed, and I was a registrar in training, paid by Medical Research Council. Quite difficult. So the best way was to go to the States, which I duly did for 1.5 years on a fellowship, where my husband is a consultant by that stage and he just couldn't go. So my mother took a year out of work and went with us, and that was fantastic. And then she realized that was the way. So she finished, retired, and lived with us for 13 years to help me to bring up my son, which was absolute blessing because, it's made an enormous difference. There were no more nannies and they could come late and stuff. So I think that made a huge difference. The work was great, so 1 year in the States, 1.5 years in the States, recommend to everybody. Seeing how things are done in another country, becoming your own person, not necessarily mentorship for women at that stage was difficult. I found a mentor in US who was a professor of physiology and medicine, a medic who been a physiologist all his life, very experienced, very senior, and very generous. So, for example, the little rats that are sitting here as a sculpture, after my 1.5 years, I was offered this colony, so breeding pairs to bring to Glasgow. And we did this. And I remember a fantastic moment back in Glasgow trying to establish my lab, my group, etc. And the phone rang. And my Ann Arbor, University of Michigan mentor said, I send you 13 breeding pairs on a flight from Detroit. And it was very cold, he said, -10. So I put little coats on them. So we started Colony, we started the lab, we got British Heart Foundation grants, the lab grew, I became a British Heart Foundation Senior Fellow, eventually British Heart Foundation Chair, and everything worked. It was great.
Well, if I was in awe before, I'm even more in awe now. I mean, you epitomise everything that is difficult or has been difficult for women of our generation, if you like. Not having the role models, having the thought that we should go away and have babies and support our husbands, but you've succeeded beyond all that. So, way beyond all that. So, I suppose, I mean, you describe your mentor as being very important, but what would you, I mean, your mother obviously played a large role in,
And my husband.
and your husband, yeah, having two very supportive people who could allow you to develop into this person. So if you were giving advice now to women following in your footsteps, and I don't think anybody could follow in your footsteps,
Plenty, much better, believe me.
But women who are at the very beginnings of their careers and struggling, what advice would you give to them?
I think have a dream and try to do it, but don't kill yourself in the process. I tended to overdo things a little on the way. And maybe now it's easier because nobody expects you to come back 2 months after you had a baby. There is much more understanding that there is this period that the woman needs to take it a little slower. I felt I had to come back because I'll lose everything. This medical rotation was going. Nobody was going to extend it for me. You know, these things didn't exist. So I think look after yourself, take time, but follow the dream. And I think if you decided to be a professor of medicine or professor of anything else, surgery, general practice, just get there. Don't rush, you have time, but do it. Don't allow people to say you can't do it. If you want to do it and if you prepare to work hard, it can be done. It might take a bit longer than Joe Bloggs, who doesn't have babies, but you'll do it.
And if you were giving them advice on what to look for in a mentor, because mentors are important, and women at the top are still not quite as numberful as they might be, they should be perhaps. So if you were advising young women to look for a mentor, what would you advise them to look for in a mentor?
I think somebody who is generous with their time, with, if it is a research relationship, with their research, with sharing, with allowing you to get ideas from them, etc. I think it doesn't need to be a woman. I think sometimes a male mentor is even better if it fits where you want to go, etc. It's just, it not always works. So not every chosen mentor will be what you want. People are busy, have other problems in their lives, etc. I think one needs to watch. Sometimes, and it happened to me, you select somebody as a mentor, looks perfect mentor, and he or she actually gives noises that yes, and then you realize that it isn't a mentor at all, because this person is really so focused on their own stuff, their own progress. And also occasionally you see in biomedical areas, especially higher up, that there is somebody who thinks is your mentor, and then you go to some meeting where there are many others and everybody thinks he or she is their mentor. And these are people who have that style of being understanding and listening and good in discussion, but actually might not deliver. So I think choosing mentor very, very difficult, and sometimes life chooses for you. So my consultant geriatrician in my early time was absolutely wonderful. She was a tough consultant, always very elegant, all times high heels, in this rather depressing geriatric ward, and yet she made it good medicine. And then she was from established Glasgow medical family, and therefore she put me in touch with her both sons, who worked in teaching hospitals and who taught me for the membership. And this was wonderful, and she organized this, and as I didn't know many people, etc., this was maybe bigger help than some other fantastic sitting and talking, how do you feel? So I think there are various ways, and in various stages of your life you need different type of a mentor. Does that make sense?
It does, absolutely it does. And if you were going to advise women who have achieved at a high level in the sciences, no matter what science, to help support the women coming through, what do you think that they can
Well,
do?
the one mentorship I know works extremely well is through the Academy of Medical Sciences. That's the area I know. And I know that they've really made a big effort to teach mentors how to mentor. Because I don't think we're born with this skill. Some people are, but majority are not. So I think the schemes, I know there are other broader schemes, and we've sent colleagues here from Glasgow to senior women mentoring schemes. I don't remember, there is a nice name for it, you probably know, where there are UK-wide sessions, etc. And some colleagues really, really benefited from this. We also have a group here in Glasgow across the university of women in a sort of pre-leadership and early leadership stage who meet together, invite speakers, organize themselves what they need to hear. And I've been to some of these events and they're very, very good. Students, I think, hugely important group. So I've spoken to students and they're such fun when they invite you and want to hear and etc. I think we need to push early. I think that's what you were saying at the beginning, yes, at school, but also during academic life early on, because that dream is formulated relatively early, and if you don't have it, you then let people tell you, why don't you be part-time and have an easy life, yeah?
Yeah, indeed, it still happens.
It still happens, yeah.
It still happens.
In my times, it was just take part-time family planning and you'll be fine there.
Yes, in mine it was, I would love to have you as a registrar, but the last woman I had used to burst into tears on the ward round, so I don't think I'll take another woman.
Precisely. Yeah.
Yeah. Yes, I would like to think things have changed.
I think things have changed. At least people are not allowed to say it. And they know they're not allowed to say it. And I think that helps. I think, the fact that people are trained for interview panels, etc., and not allowed to say it. Maybe they think it, but they're not saying it. I think that's helpful.
I can say, well, that's not that long ago I was asked to stand down from an interview panel because, and I quote, they didn't need me anymore as they no longer had any female candidates.
That's really depressing.
Within the last 5 years.
That is really depressing.
And not my current institution.
Okay. But there is another side of this spectrum. In a senior woman in a small institution who has to be on so many panels that she cannot do her work. I can tell you a story on this. I had a phone call about a few years ago from Sweden, from an institution, higher education institution in Sweden, where the rules are the rules, and there had to be a woman on the panel, and they were appointing a professor of cardiology or cardiovascular medicine, and they couldn't find one anywhere. And the chairman of the panel, very senior professor, begged me to come on short notice to Sweden, which I couldn't do. So I said, I'll contribute in writing, it can be a teleconference. And he was almost crying. And that is taking all this into such extreme that it actually probably defeats the purpose.
Absolutely, definitely.
So that's...
Yes, I think the more women there are, easier.
But now it's much easier. I don't think in the University of Glasgow there is any difficulty to have a woman on any panel anymore, and I think we've done it. I have 50% women on my college management group, and that's really now getting there.
Yes, so we look around at ours sometimes, and it's nearly all women, so we have to be careful we don't go too far the other way. Well, thank you. That was excellent. I mean,
you're happy?
I'm very happy. I mean, you think of the people who are moving to this country from other countries because of difficulties in their own home country, and their education is disrupted or whatever, and they think, I'll never make it, I can't make it. But you're right, hanging on to the dream and finding a way is the way forward.
Yeah, why should I change? The fact that I changed the country doesn't mean that I changed my plan. So the plan remains the same, just I need to adjust to different circumstances, I think. PLAB is the name of the exam. PLAB.
Yeah.
Proficiency something of something. PLAB. Very important. It's like FM Gems in the US. PLAB. It still exists.
The teaching hospital pathway, direct career pathway, is the way to go, because as you have demonstrated, that there is a huge amount of value to be picked up from hospitals that are perhaps considered to be lesser hospitals, but it's the people there, the quality of medicine that they actually provide, and the learning experience, and making the most of that learning experience in any situation that helps you to get where you want to go.
The interesting thing with Paisley and this rotation was that we learned more medicine because there was more unselected cases, etc. And the head of medicine there, who was a husband of my role model consultant, was a very, very good physician who always examined patients from the feet in order not to miss anything. I'm still doing it now, many years. And when it came to Part 2 membership, all of us who were in that training group passed, and colleagues from very posh teaching hospitals didn't, because they didn't see enough. And we were extremely proud. And in the Royal College of Physicians and Surgeons of Glasgow at that stage, they put the list of those who passed on the wall, outside wall of the college. I don't think it's allowed anymore.
Public humiliation or
That's right.
celebration.
Well, only those who passed, didn't pass, weren't there. It was coming, going ashen and going home. And then who passed went for the sherry reception up to the room in the college, St. Vincent Street. And this was my son's first birthday, 9th of February, where the results became available. And we came with the baby to see the results, my husband and I. And we were ushered into that sherry reception room. Apparently that was first time the baby was ever in this room.
I can believe
they
that.
let us in though.
I can definitely believe
They
that.
let us in. And here we were at the sherry reception with 1-year-old Peter, my son. That's just...
So your son is the journalist then?
My son is the journalist, a political editor in
I
the
see his
Telegraph
name all the
newspaper.
time, yes.
He's
Yes.
actually moving on. So he been for 3 years the youngest political editor in any broadsheet in London.
Gosh.
My boy, yes. So working mother all the
Working
time.
mother,
Didn't harm him much.
Didn't harm him at all, did it? No.
But he was also patient. I think he was patient. I wasn't there for every school play and other stuff. My mother went, we coped, but I'm sure that there were times where maybe I wasn't one of the mothers who were always there. But you can't do everything. And I think one shouldn't kill oneself over
I
this.
think you're right. As long as you've got that support network that's allowing this child to develop, you obviously have. So he's not done badly.
And
sure.
he is much taller than I
Oh,
touch here. Yes, so
yes.
he's grown. It's fine.
So you've achieved on all fronts. That's quite.
No, I haven't. It was really, other nice people around me who helped. I haven't done anything. I just, the feeling is I came always in the morning to work on time and then did what I had to do. And I think the thing is to keep walking.
I think you're right.
Do not stop. Do not get frightened.
Yeah.
Just keep walking.
Just keep going.
Mm.
Well, thank you, Anna.